Okay, so this is our today's case. We are planning two implants in the lower jaw in the area of 4.6 and 4.7. Okay, 4.6 and 4.7. So let us see the cross section of 4.6 area. You know how to shuffle between these windows? Hmm? So unless you practice at home, you won't be able to understand what I'm doing. Okay, so this is the cross section in the 4.6 area. So the implant size here is, so you go to the implant section and then you will know implant size is 4 into 10, TS4 4 into 10. ठीक है, इसी से आपको समझ आ जानी चाहिए कि कौन सा साइज लग रहा है, राइट. एंड यू आर गोइंग 0.5 to 1 mm subcrestally and you will be 2 mm away from the nerve here. So 410 is the size here. Now if you want to see the bone quality here, you just hide the implant and then see the bone quality. How much is here? 829, 1160 Hounsfeld unit. You can see the Hounsfeld units here, 1216. So overall bone quality is D2. Hmm? And the if you look at the cortex, so it is D1, then D2. So it's a good bone quality, but you cannot insert a wider implant here. You have to go for a 4 mm diameter implant only. And when you are giving a 4 mm diameter implant in the posterior molar area, it has to be TS4. Do not go for TS3 because TS3 is actually 4.25 at the uh, crestal part and TS4 is 4.45. So you need actually 4.5 mm diameter implant for the posterior area, because in the posterior the masticatory pressure is too much. It is around 200 Newton centimeter. So you need a wider implant there. But here you are not able to give a wider implant because of the width, less width. So we have planned a TS4 4 into 10. Okay. And this area 4.7. Now you see the shadow here. This is the shadow of posterior, the previous extraction into this area. Okay. So if you look at the bone quality into this area here, bone quality here 1183, it is still good. 816, so it is still good. So bone quality is not bad into that area. It is only that you are having a ghost shadow of the previous extraction. Okay, but when you are planning it, so you need to be parallel to this. If you try to go a little posterior like this, then you need to tilt it like this. Okay, so if you do that, these two implants will not be parallel and you are compelled to give a what, seam retain process. Okay, if you want a screw retain process, you need to be like this only. Okay, so they need to be parallel to each other. So the size in the 347, 37 likha, it should be 47. You can change the 47 and this is 46. So the size in the 47 area is, what is the size here? 5 into 8.5. Okay, so after you have planned this, you have planned the uh, implants, then you make this guide. I'll show you how to make the guide in the afternoon session. Mandible model with teeth we have deleted. Nerves we have deleted. Pre-op scan lower jaw, and you can hide the implant as well. Surgical guide. So this is the guide we have made. Okay, so now you see this guide is having two guide holes. So this one is for an implant of 4 into 10, and this is for an implant of 5, 8.5. So length doesn't matter, the diameter is. So for a 4 implant or 4.5 implant, the diameter of this guide hole is 5.1. Okay, and for a 5 diameter implant, the diameter of this guide hole is 5.8. Right, so that correspond to the barrel on our drills. So for a 4.5 implant, our barrel is 5 and for a 5 implant, the barrel of the drill is 5.7. So when you see the kit, then you will be able to understand what does it mean. Okay, so this is what we will be doing today in the area of 4.6 and 4.7. So this will be our guide. So we'll just place it in the mouth. Yeah, and we will start with the tissue punch, and after removing the punched tissue, we'll be using the flattening drill and then the subsequent drills. So all these drill sequence I'll be showing in the on live surgery, and the whole procedure can be completed in just 15 minutes, because now you don't have to worry about the direction or anything. Okay, so this patient has agreed for the lower jaw now. So if the patient agrees for the upper jaw as well today, so we'll be doing that also. But by and large, he's saying ki I will get it done next time. Okay, so upper jaw bhi dekh lete hain, so that you know what we are. So this is the upper implants 1415. 1/4 implant will be, now the size is 3.5 into 13. Now you can go for a 4 diameter implant as well. Here, let us see if you go for a 4 implant, 4 13. Now you see you are left with the fairly good amount of bone around. So even 4 is okay. It's possible to do 4 implant as well. Okay, the bone quality here is low, as you can expect it in the maxilla, but still it is good enough. Roughly D2 D3 type of bone we are having. So you can actually go for a 3.5 or 4 implant in the upper jaw. But if you go for a 3.5, you'll be left with more bone around, and there are more chances of success if you are left with more bone around. But because it's a premolar, you should prefer a 4 implant. Okay, so 4 into 13 for this area, and then 1.5 area, the implant size will be 4 into 8.5. Okay, so you can go for a 4.5 also. Let us replace it with 4.5, 8.5. Okay, so even 4.5 is okay. Because you are going guided, So if you have you are supposed to do it freehand, then always go for a smaller size. Okay, when you are going guided, you know exactly where you are placing the implant. So here you can actually go for a 4.5, 8.5 as well. Okay, so with 8.5 you'll be able to engage the opposing cortex. So you will be doing drilling for the 7 mm implant. Then we'll be using the sinus lift instruments to lift the sinus with indirect sinus lift, and then place an implant of 4.5 into 8.5. Okay, so two implants, 4 into 13 and 4.5 into 8.5. Okay, and you see they are parallel to each other. So parallelism is important if you want to give a screw retained prosthesis with both the crowns splinted together. Okay, so this much parallelism you are not able to achieve freehand. You can plan it, but achieving it freehand is a difficult job. So that is why the guided surgery is very important to get the best result. So let us see the guide in this case. You go to the surfaces, mandible model, maxilla model. Good morning, Ji. So you can see the exit of the implant as well, the parallelism. If you add the guide tubes, now whatever portion of the guide tube is overlapping the tooth, that will not be that will be merged with the guide only. So you don't have to worry ki it is uh, overlapping the teeth, because that area will not be printed. Okay, you should be concerned only about the central hole, that it should not be touching the adjoining tooth. Central hole should not be touching. The whole guide tube can be touching, no problem with that. Okay, so central hole is not touching the adjoining tooth, because it is here where your barrel will go. Okay, so you can subtract anything and see the things individually. So this is our guide. Good morning, Ji. Okay, so it is having these windows. The guide is having windows, so this will tell you if your guide is perfectly seated in the mouth or not. Okay, so how will it tell? You just see. Yeah, so when you place it in the mouth, so you should be able to see these teeth here, and there should not be any gap here. So you will know that it is perfectly sitting. So this is one thing that should be checked. Otherwise, all the undercuts that are there in the model, they are being taken care of by the software. Okay, you won't be feeling any difficulty when you place the guide in the mouth, because all the undercuts are automatically removed. Not like dentures where you grind the denture and then try to place it. Here it won't happen. Okay, it will just sit there. You just have to hold it with the hands and then you start drilling into this. Okay, so we have both the guides ready, and we'll be doing the lower jaw first. If the patient is okay with the upper, we'll do it this time. Otherwise, we'll do it in the next seminar. Okay, after 2 weeks, 3 weeks, we'll be doing the upper jaw. Okay, so this was about this case. The other case is Iqbal Singh, the third one. Second case, we are doing only with the OPG, right? Because that is the way you need to learn without any technology. We'll open it, we'll see the bone on the buccal and the palatal side, and we'll be drilling. You know, when you are doing analog surgery, you you need a good exposure of the bone so that you can actually direct your uh, drills accordingly. But with the guided, it is super easy for the patient. Now this case, we have history of extraction 3 months back, but still you can see the shadow of the extracted teeth. Okay, so let us see what bone quality the patient is having in these shadows. You see this shadow 7 746. Okay, so this is not soft tissue, this is bone which is maturing. Okay, so you don't need to worry about this. And here it is, yeah, it is D4 type of bone. So in the interdental area, interradicular area, you you will be having some good bone, this area 1421, and our implant should go into this direction only. So we might be using the asset kit, we'll be drilling just one hole and then expanding the bone there. Okay, otherwise the drill will venture into mesial or distal socket because it is softer there. The drill will follow the path of least resistance, so you need to be very controlled there. Okay, so this is actually the position where you should be placing your implant, in the interradicular area, because that is the most axial position. Okay, width is, width भी देख लेते हैं. Around 2 mm. 1.8 drill. Say you can just drill one hole and then you expand. But remember, these areas are not hollow. They have bone which is not mature enough. So it will not be that difficult as you do with the immediate extraction. Okay. Hmm? Yeah, it can slip. So you need to be very careful. So it is a little difficult, challenging case, but Okay, so this one we are doing freehand without any guide. But if we can do this guided, it will be very easy. That would have been perfect. Hmm? Guided. Okay, the third surgery is that Kulwant Kaur. Was the OPG? You have the OPG?